Hello, hello. How's everybody doing today, Facebook? How's everyone doing? I'm gonna let people get on. I have my nurse hat on today, so I'm gonna let some people get on real quick. There you go. How are y'all? How y'all doing? If you can, please share this video. Please share this video. I am going to be talking about COVID today. Everything COVID. It will take up the entire 30 minutes. So I'm going to let a few people, I'm going to give people about 2 minutes to come on. Hey. And we can get right into it. It's been a long morning. I technically don't have any tea today. I'm drinking a Fit Aid right now. But actually, let me shout out real quick to Black Coffee. I spend a lot of time at Black Coffee. I don't drink coffee, I drink tea. So they have really good tea. The African Autumn is really good. They know what I order there. So shout out to Camille and Tara and Mia over at Black Coffee. It's been a great neighborhood community staple since they opened in the fall of 2019. So we'll get one more minute and we'll get everybody in and we'll start talking about it. We'll talk about our event last night too. We did not get to stream it to Facebook like I wanted because this girl right here did not have her settings on right. That's my fault. I will own that. So I'm sorry. So yeah. Oh man, ¿cómo están? Bienvenidos para estar aquí conmigo. Vamos a platicar acerca del tema de COVID, la vacuna, las razones que gente no lo quiere o lo tiene miedo o tienen preguntas o no entienden la vacuna, dónde lo pueda recibir, dónde la pueda encontrar. Entonces me voy a platicar todo este tiempo de té conmigo acerca del tema de COVID, okay? All right, I'm going to get started, you guys. How are y'all? I am Tara Wilson, official candidate for Fort Worth City Council District 4. Thank you guys for being with me today. Tea time with Tara. We'll get off around 1. So I decided today that I wanted to talk about COVID. I hadn't talked about it yet, like directly. It's something that is a part of my life all the time in the ER. But there's a lot of misinformation around COVID, a lot of misunderstanding about the side effects, what happens when you get it, all that stuff. So I want to address it head on as a medical professional I am and give you guys the truth and the real information. So that's what we're going to talk about today. But first, bueno, ¿cómo estás? Soy Tara Wilson. Soy postulando para el Consejo Municipal de Fort Worth, Distrito 4. Okay. Hey, Furby. Y otra vez vamos a hablar acerca de COVID, pero primero me voy a platicar del junta que tenían ayer en la noche. Quería que lo va a hacer vivo en Facebook, pero no fue porque yo no hacía los proper, como dice, settings en mi laptop. Entonces no lo podría ponerlo en Facebook. Entonces ahí está el video del Zoom. Ahí está el video de Zoom de la junta y la plática acerca del Distrito 4 y cosas como policía y en qué manera necesitan tratar nosotros con justicia y entonces y para las comunidades también y a ver cómo necesitamos invertir en cosas que necesitan la clase de trabajadores para que tiene equidad y justicia. Entonces, por favor, encuentra el video y dime qué piensan ustedes. Si estaba en español, tenemos un chat en español. Entonces me voy a poner eso en Facebook también para ustedes. So, last night, I had the meet and greet event. It went really well. You guys, 44 for District 4 got officially kicked off last night. So hashtag 44 for District 4 is our new fundraising campaign to get the word out, to meet everyone in District 4, to talk to them. So if you can, donate, please. Share this video. bit.ly/44 for District 4 so that we can get this campaign going. Entonces, apenas empezó el fundraiser que dice 44 por Distrito 4, porque necesitamos encontrar los vecinos del Distrito 4 y hablar con ellos acerca de qué quieren ellos para nuestras comunidades y los vecinos de todos. So, entonces, por favor, si pueden donar, es bit.ly/44 por Distrito 4. So if you can, go check out that video, share it, please. But we'll get right into COVID. So there's 2 shots for COVID. There's the Pfizer and there's the Moderna. I think Pfizer's are like, I got the Moderna shot. I got my 2nd dose yesterday morning. Even within medical professionals, there's a discussion about whether we should get it or not, and everybody has their opinion on it. And it's fair because it's new. And so we are still learning things about COVID. I would stress to all of you that we are not going to know everything about COVID for quite a long time. So I would suggest to you that you get comfortable with not knowing everything about COVID. I know that's not what people want to hear, but it's just the truth. And so as somebody who treats COVID patients, that's the reality that we've had to face. We do not and cannot treat every COVID patient the same. The symptoms are different in every person. Some people do lose their sense of taste. Some people don't. Some people do get diarrhea. Some people don't. Some people have cough. Some people don't. They'll get an x-ray and then they'll have what we call COVID lung. And so, we have to do the best thing that we can do with the presentation of the patient in front of us. And that is how the medical community is approaching COVID. For the most part, yeah, you come in, cough, runny nose, not feeling good, achy all over kind of situation, you're going to be tested for COVID. And even if it doesn't come back as COVID, you're still being cautioned to isolate and self-quarantine at home and stay home till you're no longer symptomatic. That would be the prudent thing to do. Whether people do it or not, we can't control. The question about COVID is the vaccine safe? So far, for the majority, like 99% of the population, the vaccine has been shown to be safe. There are some instances of people having allergic reactions to it. The advice is that if you are a person that has an anaphylaxis reaction to something, so like if you're walking around with an EpiPen, that you're allergic to bees or you're allergic to nuts like that, and you have to carry around an EpiPen with you, they're suggesting that you need to think about whether you get the vaccine or not. People are still getting it and they're just fine. What they're doing is you go get the shot and you wait at the clinic or wherever you're going to get it for about 15 minutes to see if you're going to have a reaction. That's typically the window of time that you will react to any injectable medication you get. IV medicines is even quicker reaction. And so that's how they're trying to deal with that. Yeah, has somebody probably had? Yes, they have. It's going to happen. Again, there's just some simple truths that we're going to have to accept. And it's just, I don't know what other way to really break it down for you. I wish that I had something better to say other than it might happen, but the likelihood of it happening is quite rare. When I got my first shot, I got my first shot on December 30th. All I felt was soreness in my arm. So right when I lifted my arm here, like it got me right there. Like, like it's sore. That's all I felt. I've had colleagues who did get COVID and then got the vaccine and they felt like run down and achy, nauseated for like 24 hours to 48 hours after they got the vaccine, and then they were fine. We don't know if previously having COVID makes it more likely for you to have some side effects from it. But understand, side effects are not the same as having COVID. They're not the same thing. You even hear that about the flu shot. I went and got the flu shot and I got the flu. No, you didn't. No, you didn't. You got fatigued. You got a little run down because your body's building this immunity to it, but you didn't full on have the flu. The flu lasts anywhere from like 5 to 14 days and you are miserable. So yes, you might have gotten some side effects, but you did not have the flu. And so I got my second dose yesterday morning. Now with the second dose, we've been told that more than likely you're gonna feel the side effects. It's like I guess it's stronger because it's boosting the first one. And so I went and got it yesterday morning, even though I know I had the event last night, but we're suggested to get it when we're going to be off a few days from work, which I was off last night and I'm off tonight. So I needed to get it in that window. So I risked getting it yesterday morning, waking up feeling like really bad, but that didn't happen. I just have some soreness in my arm. Again, my arm is sore like here. That's all I have. That's it. If I get sick later on tonight, I'll let you guys know. I'll let you know. So that has been my experience with the vaccine. And so I've got some stuff pulled up so I can answer like some pretty big myths that are out there. The first one is that, okay, so the COVID vaccine does not have live COVID in it. There is no live virus in the COVID vaccine, neither the Pfizer nor the Moderna. So you're not getting a live version. Like in the flu shot, there is a very tiny, tiny speck of a live version that helps you build up immunity for the researched versions of the flu that will make you very sick and hospitalize you. So then that's the reaction that your body gets. The current COVID vaccine uses messenger RNA. Basically, it goes to your cells and it like leaves a blueprint for COVID. And then those cells, like they go to it and it's like they're studying it. Right? Like if you imagine someone put a plan on a desk in your office and everybody needs to come learn it. Everybody's standing around the table and they're looking down at it and everyone's reading it. That's kind of what your cells are doing in your body. And so they study the blueprint of the COVID makeup and they create proteins. It triggers an immune response in your body and then it creates proteins to attack COVID if it comes into your body. It does not alter your DNA. So we'll get into why that might be a belief in just a second, because I do want to address vaccine hesitancy and just talk about how the fear of the vaccine is valid, and I myself personally understand why, but I'll get to that in just a second. I'm just trying to give some facts about the COVID vaccine. So the COVID vaccine does not have any live version of COVID in it. It's essentially giving your body the blueprint to the COVID virus. Your body is then studying the blueprint and it's triggering the creation of protein antibodies in your immune system. So Um, let's see. Estoy hablando acerca de COVID y ahí está mucha información aquí que no está cierto. Entonces te quiero dar información verdadera. Y la primera cosa es que yo me obtené la vacuna para COVID porque yo soy enfermera, trabajo en salón de emergencia y trata a pacientes que tienen COVID. Entonces yo me fue y me recibió la primera parte de la vacuna el 30 de diciembre. Yo no tenía efectos de la vacuna, nomás como cuando me levantó el brazo me picaba aquí como como un dolorcito, pero es todo. Y entonces ayer en la mañana recibió la segunda parte de la vacuna contra COVID y ahora también me duele cuando me levanta mi abrazo, me duele aquí un poquitito, es como ardor, un piquete, un picazo aquí, como me muerde un poco, como cuando me levanta. Es todo lo que ha pasado. Sí tengo amigos que están enfermeras y están doctores que lo pegaban con COVID. Yo no me pegaba con COVID, nunca lo agarró COVID yo, pero ellos sí lo encontraron a COVID y recibió la vacuna de COVID y como para un día media, estaba un poco enfermo, como tenía ganas de vomitar, como nomás no sentía bien, estaba un poco débil y es todo, pero es todo que pasó, quedaba en la casa y entonces regresó a trabajo. Entonces, si la recomendación para gente es que si ustedes tienen una alergia que está muy profundo, como usa una de la pluma del EpiPen, porque tiene una alergia como a nueces o algo así, necesita platicar con tu doctor o la profesional médico acerca de los que pueda pasar si lo da la vacuna. Pero es muy menos que va a pasar algo a usted. Si puede poner un poco débil, si puede poner con náusea y vómito, pero no más para como 2 días y entonces se pasa. Entonces es tu decisión si tú quieres la vacuna. Entiendo que tienes miedo y eso es razón que estoy aquí ahora hablando con ustedes para que pueda dar información verdadera. So I just tell them that the same thing I just said in English. So the side effects, it doesn't have live virus in it. The other myth is that if you've already had COVID, should you get the shot? Absolutely yes. You can be reinfected with COVID. It's not happening a lot, but it has happened. I've had colleagues be reinfected with COVID. So you definitely want to get the vaccine. There are different strains of COVID too. So maybe the strain of COVID that you were sick with was one version, right? But the shot is going to protect you from another version. That's also something to consider. Is that a guarantee? I can't say that. Again, like I said, there's so much that we don't know for sure about the vaccine, but I think a little bit of critical thinking will help us better protect ourselves and inform ourselves with real information. La pregunta es que se me cayó con COVID antes que todavía lo necesita la vacuna contra COVID. Y la contesta es sí. Y porque hay diferente, un variedad diferente COVID ahí. Como ahora como estás 3 diferentes tipos de COVID. Entonces, si tú enfermó con una de los tres, pero la vacuna te va a proteger a los otros dos, entonces no necesita recibir la vacuna para COVID, para que te protege. Y recuerda, cuando tú proteges a tu nuestra cuerpo, entonces está protegiendo a la familia también en la casa, ¿ok? Entonces, si lo necesita recibir la vacuna, si pegaba con COVID o si caí mal con COVID, si todavía necesita la vacuna. Do I still need to wear a mask if I get the COVID vaccine? 100% yes. Like, social distance and masking is not going away. I personally will do it for the rest of my life. I don't know, I'm traumatized by it, but I'm masking up everywhere I go. At the beginning of COVID, when we were having problems with PPE, I learned how to sew, and I came up with my own mask template. And actually, the mask that I created, I found a safe filter material that matched the same level of N95, and I made filters for my mask. It fits very snug like an N95, a real one that we use at the hospital. So it seals to your face. It doesn't let air out. I wonder if I think I have one over here actually. Yeah. So this is for like a men's size, but basically I made this mask. I learned how to sew during COVID, and in case we went short on PPE at the hospital because they were being stingy with it, that's neither here nor there. I decided to make my own. So at the hospital, we do a lot of mask on, mask off, especially of the N95. So I created this to where we would tie this around the base of our neck, right? And when we came out of the room, right, we come out of the room and we needed to pull it down to put our other mask on. This would come down and hang around your neck still. It would still be there, and you would have quick access to just throw this right back over your head and it would stay in place. And so, you know, I embraced mask wearing like at the end of February of last year. So if you get the COVID vaccine, you still need to wear your mask. You still need to social distance. We don't know if you could still be an asymptomatic carrier after getting the COVID vaccine, whether you can pick up another strain, all that stuff. So just, you still have to wear your mask and you still have to social distance after getting COVID. La pregunta es, ¿todavía necesita poner mi cubrita después de recibiendo la vacuna contra COVID? Sí. Sí. Otra vez, hay diferentes tipos de COVID. Y también, si infecta con los otros que están diferentes y está caminando afuera sin de tu cubrita, sin de tu máscara, puedes todavía infectar a otros. Entonces, para proteger a otros, pero para proteger a usted, todavía necesita poner cubrita y todavía necesita a quedar en la casa si puede y todas esas cosas. Entonces, por favor, continúan poniendo la cubrita en tu cara. So please keep wearing your mask. If you don't like the mask, like, go find some mask that you like. Like, I've got, like, my kids have all these colors, and now they match all my outfits. And, I mean, it's kind of just one of those things where you got to, like, embrace the suck. That's a term that I use for myself when I'm in really tough situations. Like, this kind of, like, isn't cool, isn't fair. I'm going to have to just embrace. I don't like it, but in the grand scheme of things, it's like the best practice to have. So keep wearing your mask. After getting COVID, after taking the COVID vaccine, will you get COVID? No. Again, COVID does not have any live version of the virus in it, so it's not going to give you COVID. Now, if you go take an antibody test, your antibody test might come back positive, but what that indicates is that the vaccine worked and that your body created antibodies against COVID, which is great. That's what you want. So, okay, la pregunta es que si me dan la vacuna para COVID, si la vacuna te va a dar COVID o no, sí o no. Y la contesta es no. Otra vez, el COVID, la vacuna de COVID no tiene parte vivo del virus adentro, ¿ok? Entonces, no más la vacuna de COVID te da un plan, ¿ok? Como información acerca de la virus y te diga al cuerpo que mira, aquí está esto, prepárate para batallarlo si lo encuentra en el cuerpo. Entonces el cuerpo dice, ok, vamos a preparar, ok, y entonces hacen una proteína en el cuerpo y si encuentra COVID, si infecta con COVID, esas proteínas que así tu cuerpo van a batallar para usted, ok, y esos son antibodies. Yo no sabe qué eso en español, ok, entonces eso es la verdad de eso. What else is there? If there are any other myths that you've heard, put them in the comments and I'll try to answer them. I've got like hair on my mouth. Okay. So then let's talk about vaccine hesitancy. People don't trust it. People don't trust it. Why don't they trust it? Well, I mean, other than the fact that like it's new, we have all this information out there about vaccines in general, right? Like, you know, have you tried to go on a board about like not vaccinating your kids? It's a whole thing, right? All the conspiracy theories are out there. Wherever you lie on that is where you lie on it. But vaccines are proven to work. But the problem is that in minority communities, especially Black and brown communities, the way that the healthcare system has betrayed their trust when taking care of them lends them to not have faith and fully trust the medical world and the healthcare system. And those feelings are valid. If we go back to history, you've probably heard of the Tuskegee syphilis study. It went on for like 50 years, from like 1932 into the 1970s. And so basically what that study was that the goal was to observe, and I'm quoting here, observe the natural history of untreated syphilis in Black populations. And so basically they infected these Black men with syphilis, did not let them know they were. They told them that they had bad blood, that they were sick because they had bad blood, and they let them be sick. They got no treatment despite being told they were being given treatment. And then they discovered that penicillin killed syphilis, that it treated it successfully, and they did not treat those men. They let them be sick, and they let them die. They let them go blind. You know, we're talking about a time that Black people just were seen as less than a full human being. And we know that some people still believe that. But this study basically says, you know, the thinking was that, you know, oh, they have primitive nervous systems. That was a term used. And that they could be tested on and it would be okay. And of course, we now know that it definitely isn't. But even more so, like coming to modern day medicine, you know, Black people encounter barriers in the healthcare system. They usually are not, the studies show that Black patients are not believed when they say they're in pain, right? Or they're not treated as aggressively as white patients when it comes to pain management. They're constantly having conditions misdiagnosed. And, or sometimes they just have treatment withheld. The experiences are there and they're modern day experiences. Also, Black women postpartum care, their antepartum care when they're pregnant is subpar to the typical white woman. I mean, the mortality rate in black women in childbirth and afterwards, immediate afterwards, is so much higher than typical Caucasian woman or non-African American woman. And so, again, you know, if you were to just write this off and say, well, that happened in the past with the Tuskegee study. There was also eugenics, right, where they sterilized women, black women, as well. So if you want to write off that history, like some people like to do, right, and they don't want to acknowledge the wrongs that have been inflicted on people in this country, okay, but you still can't get past the fact that currently there are some people that still think that black people don't experience pain the same way that white people do, or that their skin is somehow thicker or something, some ignorance like that. It's not true. Skin is skin. I personally have never heard that from a colleague in my experience in healthcare in my 10-year career. I hope I never do, because I might lose my job. I will not be very nice to that person, because that's ignorant thinking. It's not based on medical facts. So, you know, I can say that from my practice, I've never thought any of those types of things. If anything, I feel like sometimes I have to advocate more for my black and brown patient than I do, you know, an affluent looking, you know, Caucasian patient. That's the reality, but it's my job to advocate on behalf of my patients. For me, I don't care who you are or what you look like. And I've said it before, I don't even care how you smell. I mean, it is what it is. You just might not have access to a shower. I'm there to treat you. Like, you're coming to us and you're trusting us to take care of you, and you're trusting us to tell you the truth, and you're trusting us to stick a needle in your body, telling you to get naked. You know, and so for me, that's really important. So in the brown community, in the Latinx Hispanic community, it's been the same thing. You know, not having pain believed that their pain is real, misdiagnosed, not being listened to. And just last year in 2020, we had immigrant Spanish-speaking women in ICE detention centers having their hysterectomies removed and them not being told what's happening to them. So they're having invasive surgical medical procedures performed on them with no real explanation of what was going on with them. That is malpractice. That is. Let me walk you through what happens whenever you're going to go in for surgery. So, and I can only speak from the ER side, but this is pretty straightforward. There is a consent form, right? And on that consent form, we have to put on there what procedure is going to be performed on you. There's a place where we write what you told us in your own words as you understand what's going to happen to you. You know, oh, I'm going to have my gallbladder removed, you know. Okay, cool. In a medical term, that's a cholecystectomy. That's written on the form. But then it's up to the surgeon to tell you what his surgical plan is, how he intends to do the surgical procedure, and answer every last question you have. And that's how that process is supposed to work. So there's a few layers in there that are in place that should inform and tell that patient exactly what's happening to them. I have gone long. So there's so much information on this that I can't fit it into 30 minutes. So real quick, let me tell you guys where you can get the vaccine. You can go to the Tarrant County Health website to sign up for it. If you're in tier 1 or the second tier of, I think they've gone on to 1B now. So if you're 65 or age or older, 16 years of age or older with at least one chronic medical condition, such as COPD, kidney disease, heart conditions, high blood pressure, sickle cell, type 2 diabetes, you qualify to get the shot. So if you go to the Tarrant County website, which we're going to get that link post, you can sign up to get the vaccine. there's not enough yet to completely vaccinate everyone. So there is a wait list for it. And I tell you to be patient. If you're a JPS patient, okay, you can go to your My Health JPS chart and the JPS My Chart and sign up through there. If you don't have access to the internet, you can call the number at 817-702-1100 to get the vaccine. And they specifically targeted some JPS did underserved areas in Fort Worth. So Medical Home Northeast Tarrant, Medical Home Southeast Tarrant, Stop 6 Walter B. Barber Health Center, and the Gertrude Charpley Watauga Health Center too. So it's kind of like one in each corner of Tarrant County that is specifically geared toward getting the COVID vaccine out. And real quick in Spanish, and then we're gonna get off. Hay muchas varias razones que gente no tiene confianza en la vacuna, y es porque en el práctica de medicina, en la historia, hacían cosas muy peligrosas y grave y feo a gente negro y gente latino hispana, y esos sentimientos, el miedo que tiene o las preguntas que tiene están válida, como es una cosa que está verdadero, que está pasando a nuestra gente de nosotros. Entonces, como en el año pasado, hacían cirugías a las mujeres inmigrantes que estaban con ICE, y lo quitaron la matriz, y ellas no sabían qué va a pasar. Y eso no es una cosa que pasa, que está normal en la comunidad médica. Entonces, si tiene miedo, si no tiene confianza en la vacuna, te entiendo y te siento. Y si tú no lo quieres la vacuna, está bien, no te voy a juzgar. Te quieres que te encuentre información para que te entiendan que entiende que tiene la vacuna, que entiende que va a pasar cuando te lo dan la vacuna, y todas esas cosas donde tú sientes que lo puedas recibir. Pueden encontrar la vacuna al sitio web de Tarrant County. Hay grupo 1A y hay un grupo 1B. Si tiene problema con tu salud y tiene edad 16 años y más, o tiene edad 65 años o más, pueden recibir la vacuna para COVID. Si tiene presión alta, diabetes, está embarazada, tiene problemas con los riñones, puede ir al sitio web de Tarrant County y pueden poner tu nombre en la lista para recibir la vacuna de COVID. Y también si es un paciente de JPS, puede encontrar la vacuna JPS. Si tienes el internet, pueden ir al sitio web de JPS y puedes encontrar el JPS My Chart. Y hacía una cita ahí con JPS para recibir la vacuna de COVID. También, si no tienes internet, puedes llamar a 817-702-1100 para hacer una cita para recibir la vacuna de COVID, si lo quiere. Okay? So basically, I'll wrap up because I'm way over. My goal in everything that I do is just to educate people. That's one of the biggest staples of nursing, is education. I'll give you the information, and then it's up to you to decide what you want to do with it. I am not judging people for not wanting to get the vaccine. It is up to you. It's your body. You can do what you feel is in the best interest of you and your family. But we will not get past this until we get enough immunity in the general public to get rid of COVID. So, you have to decide what part you want to play in that. Me personally, I was okay with being a guinea pig. I'm already neck deep in COVID, have been for an entire year. And, I wanted to say I got the vaccine because I could tell you that you should too. So I'm not going to ask you to do something I myself wouldn't do. So that's why I got the vaccine. And I hope that it works. I believe that it is, and I believe that it will. But I just came on today to really give you the truth information from the nurse in the ER who treats COVID patients on a weekly basis. So that's going to be it for today. Otra vez, mira, si quiere la vacuna, agárralo. Si no lo quiere, entiendo. No te va a juzgar si no lo quiere la vacuna de COVID. Pero mira, no te para, no lo recibas porque no tienes información verdadero, ¿ok? Entonces, aquí estoy educando a ustedes con información verdadera para tú puedan hacer una decisión con conocimiento. Entonces, si lo agarras, está bien. Si no, es tu decisión. No los vamos a batallar COVID si no tienen la población general inmuno, si no están inmuno. Entonces, ¿cuánto tiempo vamos a durar con COVID si nadie lo agarra la vacuna? Entonces, es una situación muy complicada, pero nomás aquí me venía aquí hoy para darse información verdadera de una enfermera que está trabajando en la salón de emergencia. Entonces, es todo para hoy. Muchas gracias por juntar conmigo. Comparte este video. Pega a mi sitio web, votetaraWilson.com, votetaraWilson.com. Sígueme en social media, donar bit.ly/44 por distrito 4. That's all for today. I'm Tara Wilson. Visit the website, votetaraWilson.com. Please share this video. Donate 44 to District 4, bit.ly/44 for District 4. And I will see you guys next week. I'm sorry for going so long. Thank you.